At what age do you stop breastfeeding your kids? Some women say you can breastfeed your child up to 7 years of age. Do you think that's shocking? Wait till you see this. We'll be right back.
I always say it's normal to nurse between 2 and 7 years. People become afraid that it's a sexual act. There isn't anything bad about breastfeeding an older child. I think it's a terrific thing.
The question we always get from moms is, when do I stop breastfeeding my child? It's not always easy to answer, and there's definitely a lot of conflicting opinions. Here's one of them.
I teach classes to pregnant couples, and when the question comes up of how long do you nurse, I always say it's normal to nurse between 2 and 7 years. 7 years old, 2 years old, don't they have teeth? Aren't they talking and walking? There isn't anything bad about breastfeeding an older child. I think it's a terrific thing. Sometimes it's disconcerting for somebody to see a child walk up and say, I want to nurse thee, or yank on the shirt. Are you tired? People aren't as comfortable with a nursing older child. Number one, because we haven't seen it. Our culture kind of has an obsession with the breast as a sex object, as opposed to a nurturing part of a mother's body. Nobody should answer the question of how long you should breastfeed. That's up to a mother and her child. Let people know that this is not some weird, cult, bizarre oddity. This is just normal moms nursing and nurturing their children.
Now, Leanne, everybody knows I'm a big proponent of extended breastfeeding, but 7 years? Do you really feel for 7 years they should breastfeed?
Well, what I understand and everything that I know is that that is normal. That children wean normally between 2 and 7. My children nursed not until 7. They were complete before then, but that's not true of every child.
But are you encouraging that a little bit more?
I encourage mothers to be the best mothers that they can be based on their relationship with their child.
Sure. That's great. I'm curious, what sort of benefits have you seen in your kids from extended breastfeeding?
I see very confident children. I see when there's an illness going around, even if they have the illness, it's a lot less dramatic than with the other kids. I see that they have a nice, comforting place to go, to be hydrated and nurtured during an illness.
Jim, are there any studies to show that there are any benefits?
Oh, yeah, there's a lot of great benefits to extended breastfeeding. Decreased obesity, increased intelligence is probably one of the biggest ones. Decreased risk of a lot of diseases, heart disease, diabetes, multiple sclerosis, allergy and asthma are decreased, and a lot of decreased digestive illnesses as well. The average, worldwide, the average is about after their 4th birthday. So as a country, we are pretty behind.
So if that's an average, then 7 is in the realm.
It's not
That's
unheard of.
Way
that's
outside the realm. Now, as an OB, I actually, I'm sorry, I'm going to take a stance on this, okay? Because I have to advise my mothers. And I think parenting is a lot about, there's times when you have to separate from your child because you're trying to get them to be independent individuals. And I think almost sometimes you extend it for yourself, because I would have liked to have breastfed.
You can't make a child nurse, and that's the difference. And people say, what's it like? But having nursed children into toddlerhood and into preschool, that you can't make them nurse, and it's not like nursing a baby. It's occasional nursing. You can't force that on a child. You're meeting a need.
I'm not saying you're forcing it, but you may be over-encouraging it.
Nobody can over-encourage that.
You know, I think what we don't want to do is, if the baby or the toddler and the mom both want to keep nursing, what's wrong is to pressure them to stop. I think that's wrong. If both of them are thriving with this relationship, that's great.
But how do you know when to stop? I mean, it's a little different.
They'll tell you there's no milk. They'll say the milk is gone.
That was a question I had for you. How are you doing as far as your breasts? Have you had any cases of inflammation or irritation?
I've been very, very fortunate. About a year ago when I left my son for a bit of time, I did have some discomfort and I had to express some milk. But currently, I'm away from him for a couple of days and I'm fine.
It is important to remember the American Academy of Pediatrics recommend breastfeeding for at least a year. And then after that, it's up to you.
And could we mention what it does for the mother? You were talking about for the baby, for the mother, for extended.
It helps them
breastfeeding?
relax and I think sleep better, and a lot of the maternal hormones are stimulated while breastfeeding, which is really, really important when they're infants, but it still lasts.
Wendy, what are your thoughts?
She runs a breastfeeding support group called the Pump Station.
I do.
I like that name.
I do, and I'm a lactation consultant as well. I think it's really up to the mom. I don't feel comfortable dictating public policy. I think a mother and a child have the right to decide that. But what I wish that as physicians you would let more people understand is that the benefits of human milk and breastfeeding don't stop at a certain age. I mean, we have so many pediatricians even in this area, which I think is pretty enlightened, telling mothers that after 6 months, there's no point in continuing breastfeeding. It's not going to help the baby. It's for the mother's emotional needs, whatever that means.
Right, that is
but
a
there's
big
reams
misconception.
of research to show that the benefits of human milk and breastfeeding continue for quite a while. It doesn't just stop at a certain age.
Exactly. I've got
Actually,
many
there's-
kids in my practice that for some reason didn't want to eat regular food, and they breastfed 12, 13, 14 months old. They were still only getting breast milk, and they were very, very healthy and thriving.
So the take-home point here is I think everyone would agree, breastfeeding, ideally for at least 1 year.
Yes.
It's okay to go longer if you'd like to. Do we all agree with that? Okay. Thanks for all of your opinions. I appreciate it. For more information, go to www.pumpstation.com or check out our website, thedoctorstv.com. Now, if a breastfeeding child isn't enough to keep you from sleeping, how about, we all know them, the snoring husband? Yeah. Hopefully you'll be able to get a good night's sleep after we put some of the best snoring remedies to the test. That's next.